Hey everyone. Today I will be presenting a critical analysis of ethical and professional behaviors in social work practice, specifically through the lens of stigma and discrimination related to substance use disorder for the Section 2 Capstone Project Part 2, Analysis and Application of ADEI and Social Work Ethical and Professional Behaviors Connected to Interventions and Evaluations. This presentation builds on my previous work and focuses on how ethics, ADEI, and social justice connect to intervention and evaluation in my practicum setting. I will explore how this issue impacts individuals, families, communities, and organizations, and how social workers can engage in transformative practice to address these challenges. Social problem recap. The social problem I am focusing on is stigma toward individuals with substance use disorder. This stigma is deeply rooted in misinformation and the belief that addiction is a personal or moral failing rather than a chronic, treatable disease. In my practicum setting, I have observed that stigma leads to hesitation in seeking treatment, fear of judgment, and lower engagement in services. These barriers ultimately contribute to poorer health outcomes, including increased risk of relapse and overdose. Addressing stigma is critical to improving both access to care and treatment effectiveness. Ethical and Professional Framework. The NASW Code of Ethics serves as the foundation for addressing stigma in social work practice. The principle of dignity and worth of the person reminds us that every client deserves respect, regardless of their substance use. Social justice calls us to challenge systems that create inequities in treatment access. The importance of human relationships emphasizes building trust and connection with clients, which is especially important when working with individuals who have experienced stigma. Competence and integrity require us to use evidence-based practices and remain aware of our own biases, ensuring that our work aligns with ethical standards. ADEI lens. Applying an ADEI lens means actively working to identify and reduce systemic oppression. Individuals with substance use disorder often face discrimination that intersects with race, gender identity, sexual orientation, and socioeconomic status. In my practicum setting, I see how access to treatment can vary depending on these factors. Ethical practice requires cultural responsiveness, meaning we must understand and respect clients' backgrounds while addressing barriers to care. Inclusion also means creating environments where clients feel safe, valued, and heard throughout the treatment process. Human rights and social justice. Substance use disorder should be understood as a public health issue rather than a criminal or moral issue. From a human rights perspective, individuals have the right to access appropriate and effective care. Stigma directly violates this right by creating barriers to treatment and reinforcing negative stereotypes. These issues are closely tied to broader systemic inequities, including racial and economic disparities. As social workers, we are called to advocate for policies and practices that promote equity and protect the rights of all individuals. Ethical practice and interventions at the individual level. At the individual level, ethical intervention begins with how we communicate. Using person-first language helps reduce stigma by emphasizing the individual rather than the disorder. Trauma-informed care is also essential as many individuals with substance use disorder have experienced trauma. Motivational interviewing is an evidence-based approach that respects client autonomy and supports readiness for change. These strategies help build trust and create a safe space for clients to engage in treatment, which ultimately improves outcomes. Ethical practice and evaluation at the individual level. Evaluation is just as important as intervention and must also reflect ethical principles. This includes actively seeking client feedback and valuing their perspective in the treatment process. Measuring engagement and progress helps determine whether interventions are effective. A strengths-based approach ensures that we are not focusing solely on deficits, but also recognizing client growth and resilience. Ethical evaluation allows us to adjust interventions to better meet client needs. Impact on families. Substance use disorder impacts not only individuals, but also their families. Families often experience stigma, shame, and confusion about addiction. This can lead to strained relationships and lack of support for the individual in treatment. In many cases, generational trauma also plays a role. Ethical practice involves including families in the treatment process, providing education, and creating opportunities for healing and support. Impact on communities. At the community level, stigma can influence how resources are distributed and how individuals are treated. Communities with higher levels of stigma may have fewer harm reduction programs and less support for individuals in recovery. This can contribute to higher overdose and limited access to care. Social workers play an important role in community education and prevention efforts to reduce stigma and improve outcomes. ADEI with diverse populations. Diverse populations often experience stigma in unique and compounded ways. For example, BIPOC and LGBTQ+ individuals may face both substance use stigma and discrimination related to their identity. Cultural stigma can also impact willingness to seek treatment. Ethical practice requires cultural humility, which involves ongoing self-reflection and learning. It is important to recognize these disparities and work toward more inclusive and equitable care. Organizational impact. Organizations play a significant role in shaping client experiences. Policies such as private pay requirements can limit access to treatment, particularly for individuals with lower socioeconomic status. Staff biases, whether conscious or unconscious, can also impact the quality of care provided. Creating a supportive organizational culture is essential for reducing stigma and promoting ethical practice. In my personal experience at my practicum setting, we relied heavily on private pay clients. The treatment centers that label themselves as luxury are often discriminating against clients who rely on insurance to cover their treatment services. Ethical practice in organizations. Ethical practice at the organizational level involves ongoing staff training and the implementation of trauma-informed systems. Cultural competence is essential to ensure that services are inclusive and responsive to diverse populations. Accountability measures, such as supervision and evaluation, help maintain ethical standards and improve service delivery. These efforts contribute to a more supportive and effective treatment environment. Group work and ethics. Group work is an important component of substance use treatment. It provides a safe space for individuals to share their experiences and connect with others who understand their struggles. Peer support can reduce feelings of isolation and stigma. Group settings also promote empowerment and help individuals build confidence in their recovery journeys. Evaluation in organizations and groups. Evaluation at the organizational and group level focuses on measurable outcomes such as retention rates, relapse rates, and client satisfaction. These metrics help determine the effectiveness of programs and identify areas for improvement. Ethical evaluation ensures that services are continuously improving and meeting the needs of clients. Advocacy and professional responsibility. Advocacy is a key responsibility for social workers. At the micro level, we empower clients through supportive and respectful interactions. At the meso level, we work to improve organizational practices. At the macro level, we advocate for policy changes that increase access to care and reduce stigma. These efforts are essential for creating lasting systemic change. Key takeaways. In conclusion, stigma remains one of the most significant barriers to treatment for individuals with substance use disorder. Ethical and professional behaviors guide how we address this issue in practice. Applying an ADEI lens ensures that care is equitable and inclusive. Social workers have a critical role in challenging stigma, advocating for change, and promoting social justice. These are my references.